The disparity of medical care in Ethiopia from the US is just tremendous. This is a third world country. Access to medical care is not available to the vast majority of the people there.
You know, our family came here when he was 5 from Korea. My parents, I think they had like $200 in their pocket or something like that. And
I joined the military to pay for my medical school.
For 10 years, he has to serve. And I said, what if there's a war goes on? But he was keep saying,
like,
it's
that's
not
not
gonna
gonna
happen.
And then
In 2005, I deployed with 414 Cavalry.
He went to Iraq and Kuwait during the war and helping the people.
The Army medical education is top-notch. It's helped me become the physician that I am now. At the time, I was working at California Hospital, and one of the surgeons I work with, he asked me one day if I was interested in participating in his Ethiopia health aid missions.
I think the days where you just send money, oh, here are some boxes, you're just gonna airdrop them and the people down there can figure it out, I think that's gone. We're gonna bring somebody who knows his stuff and who could at least transfer some of this knowledge.
So I thought about it and I decided it would be an honor and privilege for me to do this, to participate in this.
So the hospital that we worked at was a brand new hospital.
They would have medical equipment donated to them, sitting there untouched because they had no idea how to use it. But what I would like to do is create an outline for the anesthesia providers here so that they can continue on that path even without someone like myself being over here.
All of a sudden, one of the nurses came and grabbed him and said, we have this baby that can't breathe. This baby was just turning blue.
I had to intervene and intubate this newborn baby.
You could see this hand just all of a sudden come to life, and that little finger just grabbing around John's hand, and that defines, why we do what we do in one little moment.
We went to a very, very small rural town called Gode. When I saw how a typical Ethiopian person lived, my heart just broke. It was, there was no hospital in Gode. There was no clinic in Gode. And you would think that people would be unhappy, sad, but surprisingly, all I saw was smiling faces, kids running to us, smiling. And they're just happy that we're here to see them and to give them a little piece of healthcare that they've never had before. I'm going to meet with Katrina and get an update on Ethiopia.
It's nice to be able to see the progress. We have been able to build a hospital and a health college there.
I hope that my going over to Ethiopia inspired someone.
John's contribution is like a ripple effect. Every time somebody reaches out to help somebody else, you create a chain of change.
Little by little, step by step, this kind of little acting could change maybe their situation.
This small little act can make such a profound impact. I think it's our duty to help.